Well, welcome to Health and Social Care. I hope you are going to choose Health and Social Care this year. Health and Social Care is a lot of fun. We've had a lot of restrictions this year because of COVID-19. We can't actually go and do any placements, and we can't bring in our outside visitors. But once you start talking about human lifespan development, and then you're talking about working in health and social care, and then we talk about meeting individual needs, and then the final unit that we have is unit 14, which is the physiological disorders.
That was Miss Hinder, my health and social care teacher, explaining the course and what units you do. Now here are some students that study health and social care in Bournemouth University.
I've always wanted to help people. I think even as a kid I remember taking care of my younger siblings or mum, whoever was sick at home. I wasn't always sure that I was going to children's nursing. I've done a few placements in hospital. I worked in the radiology department. It gave me a chance to observe other nurses as well as if radiology was for me. I've also done a work experience placing with the nurses, which made me certain that I wanted to do nursing. But it was only a couple of months before my actual UCAS application that I was certain this was for me.
In Unit 1, we cover multiple theorists, which include Piaget, who discovered the 4 stages of development, Chomsky, who discovered the learning acquisition device, Bowlby, who looks into attachment within children, Giselle, who discovered the maturation theory, Bandura, who conducted the Bobo doll experiment, discovering the social learning theory, Cummings and Henry, who discovered the disengagement theory within the elderly, and Holmes and Rage, who discovered the social readjustment scale. These theorists, as well as many themes within health and social care, are linked with many subjects, including psychology and sociology.
What is health and social? Well, Unit 1.
It's about human lifespan development, and that's quite self-explanatory itself. It talks about what happens at each life stage and how the body grows and develops for both males and females.
There are 4 types of development. This is called PIES: physical and intellectual, emotional and social.
We also learn about multiple diseases and illnesses, and this is very eye-opening as we learn about how these affect people. We also learn about what happens at every life stage. For example, at later adulthood, this is the elderly. They start to become weaker, and we learn and start to understand why and how this happens to them, and how to slow the process down to live a longer life.
And there's this stereotype about how health and social is not for boys, when it is, as it talks about a lot of job opportunities that it links in with, especially in the health sector, as you know, you learn about all the different types of professionals that you can be, and how important they are, and how they can impact lives, and how you can change lives for the better.
This is a student from Barclay Academy who is currently studying adult nursing at Bedfordshire University.
In Unit 2, we develop our knowledge and understanding of the different healthcare professionals in health and social care. We learn about their roles and responsibilities and the many sectors and professions that they work in. In health and social care, we recognise what professions are primary, secondary and tertiary. We also understand the different services provided and whether they are public, private or voluntary sectors. These services include hospitals, nursing homes and mental health services.
I was working as a healthcare assistant. I learned loads of different skills. I was in lots of different situations. So I was in people's homes by myself or with another healthcare. I was in hospitals. I enjoyed it and it was invaluable. It definitely made me realise that midwifery was for me.
In Unit 5, we focus on topics such as discrimination and equality when dealing with individuals' care and support needs. Examine principles, values and skills which underpin meeting the care and support needs of individuals. Investigate the principles behind enabling individuals with care and support needs to overcome challenges. Investigate the roles and professionals and how they work together to provide the care and support necessary to meet individual needs.
Picking health and social care is a great way to develop and learn how to care. I feel as though this subject is good as you almost get to learn how to take care of yourself by learning about things such as diseases, mental health and genetic diseases, and that's only some of the curriculum. Another thing I enjoyed about health and social care is something called PIES, which is symbolised as physical, intellectual, emotional and social. I really enjoyed analysing and picking apart on how things can affect people personally in so many different ways. If you would like to learn more about being more self-aware, looking after others, or going to an NHS-based career, I highly recommend taking Health and Social Care. I believe I've learned so much from it, and you can really benefit from learning things in health and social care and incorporate them into your daily life.
The first year you do one piece of work, which is a piece of coursework as well as an exam, and then the second year is exactly the same thing. So in all, we have 4 units, 2 units are exam units and 2 are the coursework units. There's lots and lots of discussions, lots and lots of debates in the class. We find many different ways to learn, and hopefully you will enjoy health and social care. We've got girls and we have boys that are in the health and social care class. And we hope you come and join us.